A team of researchers at University of Nebraska Medical Center are making strides in eradicating a different, more deadly virus. 3 News Now reporter Kent Lutzen tells us more about a potential drug that would revolutionize care for HIV.
I remember putting this patient on a respirator, gasping for breath and barely alive.
Dr. Howard Gendelman remembers what it was like working in a New York hospital during the HIV/AIDS epidemic in the early 80s.
He said to me, "Doctor, save me. I'm dying, save me." And I knew I couldn't save him, but doctors are supposed to save people.
Watching young, healthy men die from at the time an unknown infectious disease had a long-lasting impact on Dr. Gendelman. So much that some 40 years later, he, along with Dr. Benson Adagwa and a team of 21 other scientists at the University of Nebraska Medical Center, are on the front lines of eradicating HIV/AIDS, a virus that kills around 1 million people a year.
So that is how we came about this idea of creating a long-acting medicine that would not only be used for HIV treatment, but would also prevent those at risk of getting or becoming infected.
The team has developed a potential drug that would be given just once a year, blocking the virus from entering human cells. Dr. Adagwa says it completely changes the way they currently treat patients. It even breaks down years of stigma attached to this virus, specifically aimed at gay men. He adds the drug eliminates a daily pill, the stress of going to the pharmacy, and gives sexual partners peace of mind.
You know, it's kind of ironic that you guys have been able to continue this virus research during a global pandemic. Has this pandemic caused any hiccups?
Of course. I mean, we're all living through the COVID-19 stage where life has changed. But what is interesting for us is the kinds of therapies that we're developing, changing the chemical and molecular structure of existing drugs or drugs that may or may not be seen for human use. Whether we can apply these technologies, whether we can apply these ideas to do broad research beyond HIV and AIDS.
Dr. Gendelman adds, in some ways, this current COVID-19 pandemic reminds him of the early 1980s, when hospitals were inundated with AIDS patients and doctors were struggling to find treatments.
All we were able to do is provide symptomatic therapy, make people feel okay, better, alleviating pain, but mostly we watched people die. And it wasn't until 15 years later that we actually were able to intervene with anti-HIV drugs.
Doctors say they have not crossed the finish line yet. The next step will be a clinical trial. Something interesting to note, during the AIDS epidemic, Dr. Gendelman worked under Dr. Anthony Fauci, who's making headlines for his work in COVID-19.